Take a look at this picture. It's Disneyland back in the 70s. Here's a picture of Disneyland today. This isn't enough to talk about Disney. It's about a more serious problem in our society. One of the most noticeable differences between this and this is the people's weights. Obesity is a growing epidemic in the country and affects over 31% of kids, and over 16% of kids are obese. This number grows as you get older. Over 70% of adults are overweight, half of them being obese. This is due to an increase in fast food and the chemicals used in the food. To combat this, professors at the University of Minnesota developed a specific type of surgery to help you lose weight back in the 50s. But the most common type of surgery performed, gastric bypass, was developed during the 60s. A gastric bypass has three main steps. First, they make an incision into your abdomen. Second, they sew or staple off a small pouch of your stomach. That's about 1 ounce, which directly limits the amount of food you can intake. And then third, they connect that pouch into your small intestine, completely bypassing 90% of your stomach and the beginning of your small intestine. Although this has been shown to work short term and combat the negative effects of obesity and being overweight, it hasn't been proven to work long term. But all of that is if everything goes right. If something goes wrong, like it did for these three women, the McAndrew sisters, they suffered from being overweight their whole life. The largest of them being 5'2", weighing 267 pounds when she was a teenager. They were tired of letting their weight control what they could and couldn't do, and so they looked to a gastric bypass as the answer. What happens afterward isn't uncommon. They were forced to completely change their lifestyle in fear of the side effects of their surgery. They had to cut out some of the foods in their diet, and they had to alternate between eating liquids and solids throughout the day. Another side effect is that food will not taste the same. David Flume, a gastrointestinal surgeon, says this is caused by hormonal imbalances in the body that are caused by your stomach not being used anymore. And if they eat any greasy foods, then they have to put up with vomiting. This is experienced in up to 70% of patients. So it's more likely that you will suffer from nausea and vomiting than unlikely. The worst out of all three of the sisters had complications that went on for months after the surgery. She couldn't wake up from anesthesia for 3 days, and when she did, she said her first thought was, "At least I'm not dead." After that, she had to go through another surgery because she had an infection and gallstones. And after 4 months and a removed gallbladder, she began to remember what a day without throwing up felt like. Now, I'm not saying bariatric surgery is like completely awful. It has been shown to help in the short term, but sorry about this. But more and more people are using it as a crutch instead of using a combination of diet and exercise. A few years ago, back in 2011, 158 people had a bariatric surgery. In 2 years, that number rose to almost 180,000. With more and more people using it, or more and more people undergoing surgery, the small subset of people dramatically affected by it adds up. 1 to 200 people die after or within a month of the surgery, and 2 to 3% of patients have life-threatening complications such as like internal bleeding, an infection, or blood clots. So instead of risking your life with weight loss surgery, you should use diet and exercise. Within the first 2 years of getting a gastric bypass, 85% of people lose excess weight, but within the first 5 years, 75% of people regain more than half of that weight. So instead of risking your life, you should use diet and exercise. Like exercising often makes you less likely to have cardiovascular disease, 20% less likely to have colon cancer. Well, you're 30% less likely to have breast cancer. Your body releases serotonin, which acts as a natural antidepressant. The most significant difference, however, is that with a gastric bypass or other forms of weight loss surgery, you're relying on something else to make the change for you. But with diet and exercise, you make the change yourself. And the more you diet, or the more you exercise, the easier it becomes, because your body boosts self-confidence. And the Center for Disease Control says you don't even need to work out like every day for a hard workout to get these benefits. You only need 2.5 hours of exercise per week, which is enough to combat the negative effects of being overweight. These are the sisters today. After suffering through complications, they learned that with exercise and proper diet, they could lose the unwanted pounds and keep them off. Their story is a reminder that with diet and exercise, you can live a happy, healthy life. Thank you.